Your nails, your breath, that itch you can't stop scratching. What do they have in common? They can all be early warnings that your kidneys are failing. I'm going to walk you through 7 signs your kidneys may be in trouble, from the least alarming to the most urgent. Stay with me. Number 5 is the critical one you don't want to miss. If you want more practical health alerts like this, hit subscribe and let's get into it. First, a quick reminder. Kidneys do a lot more than make urine. They filter the blood, removing waste and excess fluid. They help control blood pressure, balance minerals like calcium and phosphorus, and produce a hormone called erythropoietin that tells your bone marrow to make red blood cells. When kidneys slow down, those jobs start to break down, and the effects show up in surprising ways across the body. Because kidneys often fail quietly, these external clues, what you can see, taste, or feel, are important early signals. Look at your nails. Do they look like this? Half and half nails or two-toned nails are numbered 7 for a reason. On these nails, the lower part near the cuticle is pale or white, and the outer half is darker. This pattern has been associated with chronic kidney disease. What's happening? When kidney function declines, protein can leak into the urine and fluid balance shifts, which can change the appearance of nails. That same loss of protein and fluid imbalance also contributes to swelling in the legs and feet, peripheral edema, which you might notice as puffy ankles or shoe-fitting changes. If you see half and half nails or new swelling, ask your doctor for basic blood tests like creatinine, eGFR, to assess kidney function, and a urine test for protein. This is usually not an emergency, but it's a clear signal to get checked. If you're seeing foam in the toilet after you urinate, or you're waking up multiple times at night to pee, pay attention. This is sign number 6. Foamy urine can mean there's excess protein in the urine, a condition called proteinuria. Protein should normally stay in the bloodstream. When kidneys' filters are damaged, protein spills into urine and causes that soapy or frothy appearance. Nighttime urination, nocturia, happens when the kidneys can't concentrate urine overnight, so you make more urine while you sleep. Both signs point to impaired filtering. The practical next step is simple. Get a urine dipstick or a urine albumin test and a blood creatinine, eGFR. If proteinuria is confirmed, your doctor will usually recommend follow-up with a nephrologist and a plan to slow progression. Don't wait if you notice a sudden or dramatic change. Number 5, the one you must not ignore, is severe persistent fatigue combined with relentless itching, frequent muscle cramps, and restless legs at night. I'm calling this the critical sign because it often reflects systemic consequences of declining kidney function. Here's why. When kidneys fail to make enough erythropoietin, you can develop anemia, which causes deep, ongoing fatigue, the kind that doesn't improve with rest. Waste products that should be filtered out can build up and irritate the skin, causing uremic pruritus, a burning, unrelenting itch. Electrolyte imbalances, changes in potassium, calcium, and magnesium, can trigger muscle cramps and the restless legs that keep you awake. These symptoms together mean the kidneys are affecting blood, nerves, and skin. If you're living with unexplained severe fatigue plus itching or cramps, this is a tipping point. Ask your clinician for blood tests, including creatinine, eGFR, electrolytes, and a complete blood count, CBC, to check for anemia and seek timely nephrology evaluation. This isn't always an immediate emergency, but it is a critical moment where early intervention can change the course of disease. Next, number 4, a metallic taste in your mouth, bad breath that won't go away, and easy bruising or bleeding. The metallic taste and uremic halitosis, bad breath from waste products, come from accumulated toxins that the kidneys would normally remove. Platelet dysfunction related to kidney disease can make you bruise or bleed more easily, even with minor bumps. These symptoms mean waste products are starting to affect the lining of the mouth and the blood's clotting ability. If you notice a persistent metallic taste, chronic bad breath despite good oral hygiene, or unusual bruising or bleeding, contact your healthcare provider for blood work and a consult. Depending on how severe these signs are, your doctor may arrange for expedited outpatient nephrology follow-up. If bleeding is heavy or you feel faint, seek emergency care. Before we move on to the 3 most severe signs, here's a practical clinical anchor. When you talk with your doctor, ask for these basic tests: blood creatinine and eGFR to estimate kidney filtration, a urine test for protein or albumin, electrolytes to check sodium, potassium, calcium, phosphate, and a complete blood count, CBC, to look for anemia. These tests together give a clear picture of kidney function and systemic effects. If any of these are abnormal, your provider may recommend imaging or a referral to a kidney specialist. Number 3 is progressive calcification, soft tissue and vascular calcification. This shows up as hard nodules under the skin, itchy plaques, or signs of arteries stiffening, which raises cardiovascular risk. When kidneys can't keep calcium and phosphorus balanced, those minerals can deposit where they shouldn't, in the skin and blood vessels. The result is not only uncomfortable skin changes, but an increased risk of heart disease and vascular problems. If you're noticing firm lumps under the skin discoloration, or if you have unexplained vascular disease, your doctor may check mineral levels and refer you to both nephrology and cardiology. This is a serious development that deserves timely specialist care. Number 2 is shortness of breath and pulmonary edema, fluid in the lungs. This is a red flag. When kidneys fail to remove excess fluid, that fluid can build up in the lungs, making it hard to breathe. Anemia and metabolic acidosis, a chemical imbalance in the blood, can add to breathlessness, causing rapid shallow breathing or a sensation of not getting enough air. Pulmonary edema is potentially life-threatening. If you suddenly feel short of breath, have trouble breathing when lying flat, or cough up frothy sputum, go to the emergency room immediately. These symptoms require urgent evaluation and treatment. Don't try to wait this one out. And finally, number 1, the most severe sign, uremic frost. It's uncommon today, but highly significant. Uremic frost looks like fine white crystals on the skin, similar to powdered sugar. It happens when urea and other nitrogenous wastes build up to very high levels in the blood and are secreted through sweat, leaving a crystalline residue. Uremic frost is an indication that the kidneys are no longer able to clear toxins and that urgent dialysis or hospital-level care may be necessary. If you or someone you care for develops a persistent powdery white coating on the skin, seek emergency medical attention right away. I want to pause here and share one short clinical note. I once saw a middle-aged patient who came in because her shoes felt tighter and she had started waking up 3 times a night to urinate. A simple urine test showed protein, and early kidney disease was caught before anything worse developed. That early detection made a real difference. This is why paying attention to small signs matters. Who should be especially vigilant? If you have diabetes, high blood pressure, a family history of kidney disease, heart disease, or if you take non-steroidal anti-inflammatory drugs, NSAIDs, regularly, you are at higher risk. Other risk factors include older age, obesity, and certain autoimmune diseases. For people in those groups, annual kidney screening is often recommended. Ask your clinician about annual creatinine, eGFR, and urine albumin testing. And if you notice any of the signs we've discussed, bring them up promptly. A few practical prevention points to discuss with your clinician. Keep blood pressure and blood sugar in target ranges. Avoid long-term or unnecessary use of NSAIDs. Stay hydrated sensibly, and follow up on routine lab tests. If you're on medications that can affect kidney function, do not stop them on your own. Talk to your provider about alternatives or monitoring. Early management can slow progression. The goal is to preserve remaining kidney function and prevent complications. Let me be clear about emergencies. Shortness of breath, heavy bleeding, or signs like uremic frost require immediate emergency care. For other signs, nails changing color, foamy urine, fatigue with itching and cramps, metallic taste, seek prompt outpatient evaluation and ask for the tests I mentioned: creatinine, eGFR, urine albumin, protein, electrolytes, and a CBC. If those tests are abnormal, your provider may refer you to a nephrologist and outline a plan to reduce further damage. To recap briefly, 7 warning signs to watch for are from 7 to 1, half-and-half nails and swelling, foamy urine and nocturia, severe fatigue with relentless itching and cramps, the critical sign, metallic taste with easy bruising, progressive calcification, shortness of breath from fluid overload, and uremic frost, the most urgent. If one or more of these apply to you, don't ignore them. Early detection often preserves kidney function. There are steps your clinician can take, and there are specialists who can help. If this video helped you or someone you know, please like and share so others can be warned. For more on how heart health links to kidney health, watch the next video I've suggested. Your kidneys and heart are in a constant partnership, and protecting one helps the other. Take the signals seriously. Your kidneys work quietly for you every day. Listen to what your body is telling you and act.